Alright, we're going to do the left lateral decubitus abdomen. And when you do the left lateral decubitus, you're going to have the patient laying on their left side. David's on his left side. I've placed a sponge underneath him to prop up that side from the table so that you can see that side better. Okay, I have the tube, the SID to the IR will be 48 inches. And I'm going to place the IR right up against David's abdomen. Okay. We're using a 14 by 17 grid. You want to use a grid for the abdomen because that is a thicker body part. Alright, our line is going to be mid-sagittal, and then our transverse line is going to be at the level of 2 inches above the crest. And here's David's crest. Again, I want to remind you, your patient will normally be in a gown. David is not in a gown just for the fact of our lab experiment. But you want to have the trousers off because of the metal, the zippers. Also, underwear bands can also present a dark density on the image. So having a patient in a gown is the best way to have the patient for this exam. Our marker is going to be placed here, indicating the side that is up. So our right side is up, so I have a right marker. You want to check and make sure that your central line here is going to be central to the cassette. We want to make sure that the diaphragm is going to be included on this decubitus. It's the only reason why we're doing this decubitus image is because the patient cannot stand for this upright abdomen. So once you have checked all of those factors, you're ready to shoot the exposure. So I'm going to ask David to take in a deep breath, blow this breath out, and hold it out. And we're going to shoot the exposure on expiration. Okay, you can breathe. Now we're going to do just the basic flat abdomen, flat plate of the abdomen, or also called the KUB. So David's going to roll back onto his back, and I'm going to bring the x-ray tube so that it is vertical, a vertical x-ray, and we'll use the bucket tray. So line up your IR with the tube head, and you want to be sure that the IR is a 14 by 17 for an adult. That way it would include the majority of the abdomen. Place your right marker on the right edge of the IR, and this, once you place your bucket tray all the way in, this will indicate that this is the right side of the patient's body. It will be at 48-inch SID. So on your KUB, palpate for the crest, put the transverse line right at the level of the crest, and then double check and make sure that you have the mid-sagittal. Okay, straighten your legs out just a little bit. Okay. Now, you can have the patient bend their knees a little bit if their back is hurting while they lay flat. Now, this is our KUB. We want to be sure our resultant image is going to include from the top of the kidneys all the way down to the pubic symphysis, which will be including the bladder if you have the pubic symphysis on. So with this, we'll ask the patient to take in a deep breath, blow this breath out, and hold your breath out, and we'll take the exposure while they hold out this expiration. Okay.